So the government has put in place a new coronavirus curbs that has been kicking since Saturday. So today is actually the first working day under the new rules. And we are seeing on social media about how many workers still have to go to the office. So there has been reports of road congestions, which brings into question whether companies actually heard about these new rules or not, that all workers from non-essential sectors must 100% work from home. And if you work in the critical sector, then you can 100% go to the office. But in reality, that didn't happen today. And we are also hearing reports about how hospitals across Java, many of them runs out of oxygen supplies. And we are hearing about how people actually died in their houses because they couldn't get a place in the ICUs or in the isolation rooms at the hospitals. So
yeah, let's talk about the lack of oxygen supply in hospitals, which are also struggling to cope. Is the health system coping under the pressure?
The health system is collapsing. I can say that for sure because we are hearing reports in Jakarta, for example. One hospital there reported that at least 33 patients died over the weekend because they couldn't get their hands on oxygen supplies. And this is not only unique to Yogyakarta, we also hear this in Central Java and in West Java. And also people were being treated in car parks here because the hospitals just don't have enough rooms or health workers to treat them.
Yeah, so is the government doing anything more to support the health system?
The government has told oxygen producers in Indonesia to allocate 90% of their outputs for medical needs and the rest is for industrial needs. And they also put out more beds, but the question now is not whether there is a place, whether there is another isolation, but there's just like not enough health workers because they have been overwhelmed by just like the sheer amount of people that we're trying to get into hospitals right now.
And you mentioned earlier the restrictions that are in place in Java and in Bali, including stay-at-home orders. You mentioned about the workers who are forced to go to the office, but what about the general population? Are they respecting these stay-at-home orders?
I think we can say that like for people who are privileged enough to be able to work from home, then they know that this is something that they must do in order to basically rein in the COVID-19 spread here. But for informal workers, this is becoming a problem. Like shopkeepers, they couldn't attend to their shops at malls or shopping centers because it's closed. So they will look at other jobs. So they need to get out of their houses just to be able to live. So we are seeing reports about people who are still outside. We are people who are still basically not heeding the social distancing measures. But you know, most of them are like informal workers, or they just need to earn a living that day.
Resty, one concerning development was that dozens of doctors who were fully inoculated with the Sinovac vaccines have died. So have perceptions towards Sinovac changed? Because there was a lot of hesitancy towards AstraZeneca when news of the blood clotting issues emerged.
So the government has been on the defense by saying that the root cause of the current surge is not the different efficacy between vaccines, but it's primarily caused by the more transmissible Delta variant. So they have been putting out message that, you know, getting these vaccines will protect you from severe cases, will protect you from hospitalization. So people have been basically queuing to get any vaccines that they can get, including AstraZeneca and Sinovac. But the demand right now is more towards AstraZeneca, which has been like clinically proven to protect better against this Delta variant.
And finally, you've been speaking with epidemiologists there. What are they saying in terms of where Indonesia is heading towards in the weeks ahead? One
of the epidemiologists that I talked to predicted that the peak will be by July and August. And one of the worst case scenarios was that Indonesia can see up to 500,000 active cases per day and up to around 2,000 deaths per day if the lockdown is not proper. So that is just something that is quite telling about the urgency of people staying at homes right now.
Resty, very concerning predictions there, but thank you very much for the update.
And thanks for having me.